So, good afternoon, and thank you very much for joining us for the plenary session on COVID-19, Lesson Learned, Preparedness and Resilience. So my name is Irene Norstedt, and I am the Director for the People Directorate here in DG Research and Innovation. Now, COVID-19 is challenging Europe and the world since 18 months back. We have seen many ups and downs. There has been over 3.5 million deaths worldwide so far, several waves of transmission, overloaded healthcare systems, shortages of medical equipment and medicines, lockdowns, closure of borders, people are suffering from rising inequalities and conspiracy theories, and also a lot of disinformation around. But we have also seen global solidarity and political unity to act together. Last year, the global coronavirus response, with the establishment of the Access to the COVID-19 Tools Accelerator and COVAX, and in these last weeks, the Rome Declaration of the Global Health Summit, the World Health Assembly deciding to strengthen the role of WHO, the G7 leaders restating their commitment to end the COVID pandemic, leaving nobody behind. And last but not least, we have seen researchers bringing into the spotlight the public attention. We have witnessed the fastest ever development of a vaccine against the previously unknown virus. In less than 12 months, that is a true world record. And we have also seen a strong shift towards research collaboration with a stark increase in the open science practices. So I'm very pleased to have with me here two distinguished speakers that has joined me for this session. First of all, I have the Commissioner for Innovation, Research, Culture, Education and Youth, Maria Gabriel. Welcome. And online with us, we have Professor Peter Piot. He's the Special Advisor to the Commission President on COVID-19, and he is the Director for the London School of Hygiene and Tropical Medicine. I am delighted to have both of you with me here today. So, Commissioner, I will start with you. In the past 18 months, there has been an outstanding experience for everybody, and for many it has been like a roller coaster ride. So what are for you the main lessons learned over this period?
Well, thank you very much for this question, and welcome to our online audience in this panel. I will be really very rapid. First, what we have learned is that research and innovation saves lives. If you were able to have a vaccine in a record time, that was exactly because for years we invested in research and innovation. That's why for me the main message is that in peacetime we should continue to invest strategically in research and innovation. They are the key drivers for our future resilience. The second is that we need coordinated actions. We have had extraordinary examples. I'm thinking about COVID-19 data platform. At the same time now, we have Vaccelerate, this European-wide clinical trials network. We need to anticipate. That's my third point. To anticipate, that means that we should continue to strengthen our coordinated and common actions with our member states. That's why you know that we are preparing a partnership for our future better preparedness and resilience. And I think that somehow that will be the first time where with member states we'll coordinate and we'll fix a common research and innovation agenda in this field. So yes, invest strategically in research and innovation, coordination and anticipation were for me the key words.
Thank you, Commissioner, for these very clear perspectives. You underlined that research and innovation and coordination actions at EU level is one of the keys for overcoming this COVID pandemic, and also to get better prepared for the future pandemics or any other public health crisis. So how do you see that Horizon Europe could be a game changer in this perspective?
Well, first I think that already Horizon 2020 was the game changer in order to tackle the present situation. So now for us, for sure, Horizon Europe should continue to be the driver for these extraordinary challenges that we are facing, but especially because we would like to offer solutions. So I think that in every single component in our Horizon Europe program, we have elements to continue to see the program as a game changer. What I'm thinking about? I'm thinking about first about our cluster health. We have now stronger budget. We need to continue to improve our coordinated actions with our health program, with our HERA, the new agency. I think that it will be crucial to build synergies. When we look at our partnerships and missions, they can greatly contribute too. This time, we would like to see how, with the entire ecosystem, we can innovate and we can propose bold, ambitious approaches in order to show that because we are taking action at European level, there will be a difference in the daily lives of our citizens, positive impact. And of course, I'm thinking about the synergies between the different elements in our Horizon Europe program. Let's think about the cooperation between the European Research Council and the European Innovation Council. Because yes, on one side, we should continue to support the frontier research. Remember, if today we have the mRNA, that was because 30 years ago, that was already projects dedicated to this research. And actually, what we need is immediately to see how from frontier research, we can rapidly support startups and SMEs that can make breakthrough innovations, that can help us to tackle the next challenges, that can create jobs, and that can affirm our European leadership in this field.
Thank you, Commissioner. I will now go over to Professor Piotr. Dear Peter, it's good to have you online. Because also a few weeks ago, you actually co-chaired the science panel, which informed the leaders' consideration at the Global Health Summit, which resulted in the Rome Declaration, which is really important. So what lessons learned and perspective do you see from a scientific point of view about this pandemic? Unfortunately, it seems like we have lost the connection with Professor Piotr. So I will then continue to ask the Commissioner maybe a little bit about, we talked about collaboration in Europe and how we will strengthen the cooperation even further in Horizon Europe. But of course, we cannot tackle this type of events ourselves. We need to work in a global perspective. So maybe you would like to give a few words in how you see our cooperation in a global perspective.
Well, I very much hope that Peter will join us very soon. But first, yes, I think you said it. This is a global crisis, and our responses also need to be global. Peter, are you here?
Yeah.
Okay, Peter. So did you hear my question to you?
Yeah, I'm very sorry. I'm the first student.
Okay, so...
Yes, I heard. And so I would say hello to both of you, but also that I would say that one of the silver linings of this epidemic has been the formidable impact of research and innovation. Can you hear me?
Yes, we can hear you, Peter.
Or,
yep.
No.
Yeah, it's okay.
Yes, it's okay.
I'll speak without... okay, so and a key recommendation of the key recommendation of the Global Health Summit scientific expert panel was, that the work is not finished, and we need to therefore invest in research and development, but not only during epidemics and crises, but before, during, and between. So that when a crisis strikes, we're better prepared, meaning that we have a strong basis to build on. And as the Commissioner said, like the mRNA vaccines, they didn't fall out of the sky. They just are the result of decades of basic research that we can immediately adjust to a search mode and deliver in ever shorter time. And this to illustrate the point of the Commissioner is that for this to happen, we need really an end-to-end research and innovation ecosystem. And we flag a number of priority areas, and such a research and innovation system is like in Europe, where we have Horizon, Europe, we have innovation, and we have HERA that hopefully will be set up soon. For me, a top priority would be to have a universal vaccine, for example. However, this will require also other disciplines, social sciences, large clinical trials network, and so on. And then I would say that one of the strong points we make is that this is research that has to be global and involve groups in low and middle income countries because the situation are different and we can all learn from ourselves and each other. And then finally, we make a strong point for independent scientific advice to guide policy decisions. It's advice, but the situation is changing all the time, and that's why our policy making in all.
So thank you, Peter. I hope you still can hear us.
Yes, I.
Okay, very good.
Yes,
so
I can see you even.
Very good. Okay. So these are indeed important issues that you have raised here and that we really need to take on board for how we can improve the preparedness and resilience in Europe and worldwide. But of course, as we know, this COVID-19 pandemic is not yet over. But when you look to the future, what would you see as the greatest concerns and what do you think research and innovation should really do about it?
Well, as you say, Irene, the top priority, of course, is now bring this pandemic under control. And it's far from over. We always have surprises and new elements. For example, now when it comes to Europe, the Delta variant that is becoming rapidly going to be dominant in many countries and is highly transmissible. But the way to go is, of course, is to accelerate as much as we can full vaccination. That is top priority. But we also have to go further than Europe, because this is a pandemic, a global issue. And as long as the problem is not solved in all countries, it's not solved anyway. That's why, making sure that there is access to vaccines is not only a moral issue, a matter of justice, but also it is critical for pandemic control, because if the virus continues to circulate in many parts of the world that have no access to vaccination, not only is that going to be a constant source of import of cases, but also it will be a constant breeding ground for new variants, which will be a problem for the rest of the world. So that's why, as was announced by the President von der Leyen at the Global Health Summit and at the G7 Summit, sharing vaccines from European countries with countries which need them most, step up funding for what you mentioned, Irene, the ACT Accelerator and the COVAX facility, and increase scientific collaboration. But our research and innovation are going to play a key role, because it's likely that we're entering an age of pandemics, that we will see more and more of pandemics, because of failure of living in harmony between us, humans, and societies and nature. And the risk of zoonosis of pandemics is going to increase. And so we need to make sure that research and innovation are going to be ready, prepare for this, play a key role, for instance, through basic research, to prepare the ground for development of tools, vaccines, treatments, etc. Better surveillance, not only in people as humans, but also in animals. We need.
Okay, I think that we have lost the connection again, sadly, but there were very interesting words from Peter there. Commissioner, would you like to have some final words in response maybe to what Peter mentioned and maybe also in Europe in the global context?
Well, I will react very briefly because I think
Yeah.
that what we need first is to continue to give more visibility to the good examples, because if you'd like to have global coordination, we need to lead by example. We need to convince people, and we have now CEPI, we have COVAX. Remember, 1 year ago, no one knows what that means. And
Yeah.
today, it's a symbol of our wish not only to work for our citizens, but to work for every single citizen in the world in order to really to help them to tackle this situation. And of course, here, the third example is our EDCTP. It's a strong signal for Africa, for our African partners, because we are here for every single citizen in all the different continents. But that means that, again, we need to continue to share information, we need to continue to share knowledge, and that's why that will be my final word. Today, we are launching our Coronavirus Global Research and Innovation Collaboration Portal, and this is, again, another proof that only together we can tackle this challenge and we can even have better future.
Thank you very much, Commissioner, for those words. Very inspiring. Thank you also to Peter. I hope you can still hear us. With that, unfortunately, we have no time left in this session, so we need to close now. But I think that you both have provided an excellent frame to proceed now to the 5 policy sessions that will follow, where we will address some of these areas that you also have pointed out. So, such as the need for further collaboration, the data sharing, manufacturing, and also the important role of scientific breakthroughs. So with this, and also the social aspects, of course. So with this, I would like to say thank you so much for listening to us this afternoon, and I do hope that you will join one of our 5 sessions that will start very shortly. Thank you so much, and thank you, Commissioner, and thank you, Peter, for participating this afternoon. Thank you.
I hope you're enjoying the rich debate and ready to rise to the challenges that have been set out there in our plenary session. So now it is time, as we said, to break into the second of 5 live breakout sessions to look at the lessons learned from the COVID-19 pandemic and how to prepare for the future. We'll take this important and very, very current issue. The live sessions to follow are 5 of them. We have a topic including the new European research area to tackle pandemic preparedness, how research and innovation can ensure that no one is left behind in the post-COVID recovery, the scientific breakthroughs to address emergencies, the added value of open science during the pandemic, and the fast and flexible production. So please select the section that is most suited to you. And remember to enjoy the debate, but also keep in mind that we do have workshops also running in parallel, so you can choose those if you want to look at something else, because there's so much going on here at Research and Innovation Days 2021. I'll be back to talk to you about the final plenary at 5 o'clock.